Hello and welcome to Human Papillomavirus, What It Means for You. My name is Nicole Holmes, and I am the training coordinator for the immunization program at the Philadelphia Department of Public Health. We have some objectives for you, and by the end of this training, you should be able to understand the history of human papillomavirus, also known as HPV, understand the United States HPV requirements, and also understand the process for vaccinating refugees. And here's the overview of what to expect during this training. We'll begin with the background of HPV, next, the prevention of HPV, followed by the presumptive approach, and then we'll close with the recap. And you're invited to turn on closed captioning at this time. Human papillomavirus. Who does HPV affect? HPV affects everyone: girls, boys, women, and men. HPV is a common sexually transmitted infection, or STI, which can cause more than 40 different types of cancer later in life. The most common of these cancers include cervical, anal, penile, anus, and oral pharynx, which is the back of the throat. Typically, people who have been infected with HPV don't know they have it. However, the body usually gets rid of the virus within 2 years. In addition to that, the HPV vaccines have the potential to prevent over 90% of HPV-attributed cancers. The body's immune system works to expel the HPV infection, but when it can't expel everything, it can turn normal cells into abnormal cells, then eventually cancer. And 10% of women with HPV in their cervix will develop lasting HPV infections that increase their risk for cervical cancer. The HPV vaccine. Gardasil is the HPV vaccine used in the U.S. Gardasil does not treat HPV infection, cancer, or genital warts. And Gardasil 9, also known as 9V-HPV, is the only HPV vaccine available for distribution and administration in the U.S. Here's a look at the pediatric vaccine schedule. Here's a closer look at the pediatric HPV dose series. The HPV vaccine, highlighted in the red outline, is administered over a 2 to 3 dose series, and the CDC recommends that children receive the first dose between ages 9 and 12. If a child misses a dose in the HPV vaccine series, it is recommended that a catch-up schedule be applied to get the child's immunizations caught up to date. Here's a snapshot of what the catch-up schedule looks like. We advise that you work with the parent or guardian of the child to ensure they receive all doses so that they're not left out of school. For children aged 9 through 14 years of age, Gardasil 9 can be given using a 2-dose or 3-dose schedule. For the 2-dose schedule, the second shot should be given 6 to 12 months after the first shot. If the second shot is given less than 5 months after the first shot, a third shot should be given at least 4 months after the second shot. For the 3-dose schedule, the second shot should be given 2 months after the first shot, and the third shot should be given 6 months after the first shot. Here's a look at the adult HPV dose series. As you'll see highlighted in the red outline, for persons aged 19 to 26 years old, 2 or 3 doses, depending on age at initial vaccination or condition, will be required. For persons aged 27 to 49 years old, you'll see the additional notes. Here's another look at the notes for the HPV vaccine. This time we're focusing on the adult HPV dose series. You'll notice underlined in red, it says age 15 years or older at initial vaccination. This means for people age 15 and up, a recommended 3-dose series should be applied. After the first vaccination, the second vaccination should be given 1 to 2 months, and then the third and final vaccination should be given 6 months after the second dose. Here's a quick video showcasing some transparency between a concerned parent and an experienced pediatrician regarding HPV.
Hey, buddy.
Hey, look, I got a quick question for you. I know what HPV is, but why does Eliza need a vaccine? I mean, what kind of diseases are caused by HPV? I'm just worried about her getting unnecessary shots. You know what I mean?
It's definitely necessary. Some HPV infection can cause cancer in the future, like cancer of the cervix, in the back of the throat. But you can protect Eliza from these and other cancers by making sure she gets 2 doses of the HPV vaccine before she turns 13.
Enough said. Thanks, Jose.
You bet.
Thank you.
The presumptive approach. Positive assumption. Healthcare providers expect patients to agree with or accept recommendations like vaccines or lifestyle changes without needing much convincing. Streamline communication. This approach makes communication simpler by focusing on the likely positive outcome instead of potential objections. Encouraging engagement. Assuming a positive response encourages patients to take action more easily. And finally, promoting adherence. This method can improve how well patients follow health advice by presenting recommendations as the norm, making it easier for patients to comply. To summarize the previous 2 slides, we have a nice infographic to illustrate the presumptive approach in 3 easy steps. First, safely assume parents will vaccinate their children. If parents consent with no further questions, go ahead and administer the recommended vaccine dose. If parents are not ready to vaccinate, move to the second step, which is give your strong recommendation. Here is where you remind or explain to the parent that by vaccinating their child against HPV, they're protecting them from cancer and that the vaccine is a school requirement. If the parents accept your recommendation, go ahead and administer the recommended vaccine dose. If the parents have specific questions or concerns, move to the third step, which is listen and respond to the parents' questions. If the parents respond positively to your answer, go ahead and administer the recommended vaccine dose. Key takeaways. To prevent HPV-related cancers, here are 3 things you can tell your patients to do. 1. If you're sexually active, make the safe and responsible choice and use condoms. 2. Don't smoke tobacco products. And 3. By age 30, women should get screened for cervical cancer every 5 to 10 years. Here's a look at the timeline of HPV and Gardasil. In 1983, HPV was identified as a cervical cancer-causing virus. In 1991, the first HPV vaccine was developed. In 2006, the vaccine HPV-4 was licensed and approved for girls. In 2009, the vaccines HPV-16 and HPV-18 were approved by the Food and Drug Administration. Later in 2009, the vaccine HPV-4 was approved for boys by the FDA. In 2014, the vaccine HPV-9 was approved by the FDA. In 2018, the FDA approved the vaccine HPV-9 for use in adult men and women aged 27 years old to 45 years old. And in 2019, 100 countries include HPV vaccination in regular vaccine schedules. Here are some additional key takeaways from this training. Children aged 9 through 14 should receive the 2-dose series. Adolescents aged 15 through adults aged 45 should receive the 3-dose series. And clinical providers should always use the presumptive approach when speaking to patients about vaccinations. Here is a list of all the resources used throughout this presentation. They will also be linked in the description box below for your convenience.